How long has it been since you allowed yourself a piece of chocolate without feeling guilty about it? If you've been living with pre-diabetes or type 2 diabetes, I'd guess it's been years. And I want to tell you something that may genuinely shift how you look at this disease. The advice you were given, that chocolate is the enemy of your blood sugar, is not just outdated. In some cases, it has cost you a tool that could have helped you all along. There is a form of chocolate on your grocery store shelf with a glycemic index of just 22. That is less than 1/3 of white bread. It contains compounds documented in peer-reviewed clinical studies to improve insulin sensitivity, lower the inflammatory markers that keep diabetes burning forward, and even support the regeneration of the cells in your pancreas that actually produce insulin. The difference between this chocolate and the one harming you is sitting on every label, waiting 30 seconds for you to read it. Today, I'm going to walk you through 5 specific types of chocolate that the evidence supports for people managing blood sugar. And pay close attention to number 5. It is the cheapest option of the 5, and it carries the strongest clinical evidence of all. Before I begin, do me a favor. Tell me in the comments how old you are and how long it's been since you turned down a piece of chocolate because you were afraid of your blood sugar. I read every comment, and your answers genuinely help me understand who's sitting with me today. Now, before I name a single one of those 5 types, I have to give you something that almost no article about chocolate and diabetes ever bothers to explain. Because if you don't understand this part, the 5 types I'm about to share will feel arbitrary, like a random list. Once you understand it, every single one will make complete biochemical sense. Here is the truth that most people miss. The benefit is not in chocolate. The benefit is in cacao. Those are 2 very different things. A mass-produced milk chocolate bar, packed with sugar, hydrogenated vegetable oil, and barely any real cacao, has almost nothing in common with the cacao bean itself, except a vague flavor. The healing compounds live in the cacao. The industrial bar simply borrows its name. Cacao contains a concentrated group of plant compounds called flavonoids, and the 2 that matter most for your blood sugar are catechin and epicatechin. These have 3 mechanisms that work directly on the disease you and I are trying to manage. The first is improving insulin sensitivity by repairing the lining of your blood vessels. I want you to picture insulin resistance like a phone line full of static. Insulin is calling. Glucose is waiting at your cells, ready to come inside. But the cell can't hear the signal clearly anymore. Cacao flavonoids work on that lining, the endothelium, and they help clear the static so your cells can finally receive the message. The second is reducing oxidative stress. Cacao sits among the highest-ranking foods ever measured for antioxidant capacity, and oxidative stress is not some abstract concept. It is one of the central reasons your insulin receptors stop functioning properly. Bring oxidative stress down, and those receptors start working again. The third mechanism is the one that genuinely changed how I think about this food. Epicatechin, the most abundant flavonoid in cacao, has been shown in cellular studies to stimulate insulin secretion and support the regeneration of the beta cells in your pancreas. Those are the cells that actually produce insulin. And in type 2 diabetes, they slowly get worn down and destroyed. The idea that a food compound could help bring those cells back rather than just compensate for losing them is a different conversation entirely. So when I rank these next 5 types, I'm not picking favorites. I'm ranking them by how much flavonoid they deliver and how strong the clinical evidence sits behind each one. Let me start with the easiest one to bring into your kitchen tonight. Number 1 is dark chocolate with at least 70% cacao. I put this first not because it's the most powerful, but because it's the most realistic place for most of my patients to begin. The flavor is firm, but still enjoyable. You can find it in any grocery store in America, Britain, or Canada. And the science behind it is solid enough that I have no hesitation putting it in your kitchen tonight. Let me give you the numbers. 70% dark chocolate has a glycemic index of around 22. To put that in perspective, table sugar sits at 65. White bread is around 71. So a square of good dark chocolate produces a slow, gentle rise in blood sugar, not the sharp spike most people assume. The reason is simple. At 70% cacao, there is far less sugar in the bar, and what remains is balanced by cacao fat and cacao fiber. Both slow down digestion. The fiber delays how quickly your stomach empties. The fat slows how fast any sugar present reaches the absorptive surface of your small intestine. Your body just doesn't see a sudden flood of glucose. Let me tell you about Margaret. She came to my office at 64 with a fresh pre-diabetes diagnosis and an A1C of 6.1. She lived alone, and for years she'd been eating 3 or 4 pieces of milk chocolate every night after dinner. She called it her reward, and she felt guilty about every single piece. I didn't tell her to stop. I told her to switch. 2 squares of 70% dark chocolate, eaten after a dinner with protein and fiber. 3 months later, her A1C was 5.7. But the part that mattered most to her was different. She told me she'd stopped hiding chocolate in her kitchen drawer. Research published in the American Journal of Clinical Nutrition has found that regular cacao consumption is linked to reduced cardiovascular risk. That matters enormously for you because diabetes already doubles or quadruples your risk of heart disease. A clinically supported portion is about 20 to 30 grams per day, which is 2 or 3 small squares. Now, here is the label trap. Many bars sold as dark chocolate or 70% cacao actually list sugar as the first ingredient on the back. The front of the package is marketing. The ingredient list is the truth. Flip the bar over. Cacao mass or cacao paste must be the first word on that list. If sugar comes first, the bar is not what the front claims, no matter how dark it looks. Number 2 is dark chocolate with 85% cacao or higher. And I want to be careful here, because at first glance, this looks like just a stronger version of number 1. It is not. The clinical evidence behind 85% and above is a different conversation entirely. Here's why. As cacao percentage climbs, 2 things happen at the same time. The flavonoid concentration rises substantially, and the sugar content drops from around 20 to 25 grams per 100 grams down to roughly 10 to 14. You are getting more of the medicine and less of the problem in the very same bite. Now let me show you the study I want every diabetic patient to know about. A clinical trial looked at chocolate with 83% cacao in 60 non-smoking patients with type 2 diabetes and high blood pressure, ages 35 to 70. Each person consumed 25 grams a day, containing 450 milligrams of flavonoids, for 8 weeks. The results were striking. Their lipid profiles improved. And 3 of the most important inflammatory markers in diabetes, CRP, interleukin-6, and TNF-alpha, dropped significantly. I want you to understand why this matters. These 3 markers are not just numbers on a report. They are the 3 lieutenants of chronic low-grade inflammation, and chronic inflammation is the silent fire that keeps insulin resistance burning year after year. When you lower CRP, you are turning down the heat on that fire. You are addressing the cause of the disease, not just chasing the symptom. There's more. 2 large Swedish studies found that increasing dark chocolate consumption to at least 50 grams per week reduced stroke risk, both ischemic and hemorrhagic, by up to 27%. For someone over 60 with diabetes, whose stroke risk is already much higher than the general population, that is not a minor footnote. That is direct protection of the brain. Now, before I go on, let me ask you something personally. What was your most recent A1C number? And has any doctor ever sat you down and really explained how chronic inflammation drives your diabetes forward year after year? Tell me in the comments. I read every answer, and it helps me decide what to cover next on this channel. A practical portion of 85% chocolate is 20 to 25 grams per day. And one of the quiet advantages of going to this percentage is that the flavor is so much more intense and so much less sweet, you naturally stop after 1 or 2 squares. Your taste buds get satisfied before the bar gets eaten. I've seen patients who could never moderate milk chocolate suddenly find moderation effortless with 85%. The bar simply asks you to slow down. That is not a small thing for someone who has spent decades fighting their own sweet tooth, and it makes consistency far easier. Number 3 takes us to the outer edge of the chocolate world. 100% cacao and cacao nibs. No added sugar, no added milk. No added fat beyond what already lives inside the cacao bean itself. This is cacao stripped down to its truest form, and from a glycemic standpoint, it is as safe as solid chocolate ever gets. Cacao nibs deserve their own mention. These are simply pieces of roasted cacao bean, crushed but not refined. Because they skip the pressing and conching steps that other chocolate goes through, they hold on to more flavonoids and more fiber than any processed bar. They are crunchy, deeply bitter, and they look almost nothing like the chocolate you grew up with. Now let me be honest with you the way I would in my office. Most of my patients cannot sit down and eat 100% chocolate as a treat. The bitterness is too sharp for a palate that has known sweetness for 60 or 70 years, and I have no interest in pretending otherwise. So I do not recommend it as a snack. I recommend it as an ingredient. That is where it becomes powerful and pleasant at the same time. A teaspoon of cacao nibs sprinkled across plain Greek yogurt. 10 grams of 100% chocolate melted and stirred into a spoonful of almond butter. A small handful of nibs folded into your morning oatmeal. These are simple shifts, but they deliver real flavonoid content without changing your blood sugar curve in any meaningful way. Let me tell you about Robert. He came to me at 71, 12 years into type 2 diabetes, sitting at an A1C of 7.3 on metformin. He'd loved chocolate his whole life and had given it up completely for 5 years. His numbers never improved. We talked about cacao nibs, and he started sprinkling a teaspoon over his breakfast oatmeal. 4 months later, he looked at me across the desk and said something I still remember word for word. "I can't believe something this good is actually helping me." His A1C had dropped to 6.8. Number 4 is sugar-free chocolate, but only the kind sweetened with erythritol or stevia. And I'm going to be very direct in this section because this is where the food industry plays its most dishonest game with diabetic shoppers. First, the science of what actually works. Erythritol is a sugar alcohol with a glycemic index of essentially 0. It carries about 70% of the sweetness of regular sugar, but your body absorbs it through a different pathway and excretes most of it through the kidneys without significantly raising blood glucose or stimulating insulin. Stevia, which comes from the leaves of a plant, takes a different route to the same destination. The steviol glycosides are not metabolized by your body at all, and they produce no measurable glucose response. So a chocolate bar sweetened with erythritol or stevia gives you a flavor surprisingly close to the milk chocolate you remember, with almost none of the metabolic cost. But here is where you have to be careful. Many bars marketed as sugar-free in the United States, Canada, and the UK do not use erythritol or stevia at all. They use maltitol. And maltitol has a glycemic index of 52. That is not low. That is genuinely capable of raising your blood sugar, particularly if you eat more than 1 or 2 squares. On top of that, maltitol in older bodies often causes uncomfortable bloating, gas, and even sudden diarrhea because it draws water into the intestine. I have had more than one patient call me in distress after a maltitol-sweetened diabetic chocolate sent them running to the bathroom an hour after dinner. So here's your 30-second rule for this category. Pick up the bar, flip it over. Look at the sweetener line in the ingredient list. You want to see the word erythritol or steviol glycosides clearly named. If you see maltitol, isomalt, or a vague phrase like sugar alcohols, without specifying which one, put the bar back on the shelf. I want to underline this because this is where the marketing on the front of the package is most disconnected from the reality on the back. A label that says diabetic friendly in large letters can be hiding an ingredient that does the exact opposite of what that promise suggests. Trust the back, never the front. And now we come to number 5, the one I told you to pay close attention to at the start of this video: pure unsweetened cacao powder. It is the cheapest thing on the shelf. You can buy a large container of it for the price of a single fancy chocolate bar. And it is the form of cacao with the strongest clinical evidence behind it by a meaningful margin. I want to walk you carefully through the study that changed how I prescribe cacao to my own patients. A systematic review conducted by researchers at the Universidade Federal Fluminense in Brazil, published in 2021, analyzed 7 clinical studies examining the effects of cacao flavonoids on blood glucose and serum insulin in people living with type 2 diabetes. The consolidated finding was this: dark chocolate or cacao powder at a dose of 25 to 30 grams per day showed beneficial effects on blood glucose and on hemoglobin A1C, along with cardiovascular protection through improved HDL cholesterol. I need you to understand what that A1C finding actually means. A1C is the gold standard. It is the marker your doctor uses to evaluate how well you've controlled your blood sugar over the past 3 months. It is not a snapshot, it is a season. And when a dietary intervention moves that number, you are looking at a real, durable change in how your body is handling glucose. Not a fleeting effect, a structural one. So why does plain cacao powder outperform even the best dark chocolate bar? Because manufacturing a chocolate bar requires pressing, conching, and tempering, and every one of those steps degrades a portion of the flavonoid content. Pure natural cacao powder, the kind that has not been alkalized or Dutch processed, skips most of that loss. Think of a regular chocolate bar like tea brewed from a bag that has already been steeped twice. There is still flavor left, but the active compounds have faded. Pure cacao powder is the whole leaf. In practice, this is the easiest of the 5 to integrate into your daily life. A tablespoon stirred into black coffee, a spoonful blended into plain full-fat yogurt, a teaspoon warmed gently with unsweetened almond milk on the stove, a small amount folded into your morning oatmeal. Every one of those choices delivers more flavonoids than a square of dark chocolate, with essentially no impact on your blood sugar curve. Let me tell you about Carolyn. She came to me at 68, 5 years into type 2 diabetes, with an A1C that had been parked at exactly 7.0 for 2 stubborn years. She was taking her medication faithfully and walking every day. She told me, almost in tears, "I have tried everything. I changed one thing, just one." The sugar and creamer in her morning coffee became 1 tablespoon of pure cacao powder, a few drops of stevia, and unsweetened almond milk. 6 months later, her A1C was 6.5. This is not magic. This is biochemistry, working quietly every morning, in a single cup of coffee. The label trap here is the simplest of all. The ingredient list should contain exactly one item: cocoa powder or cacao powder. Nothing else. Avoid hot chocolate mixes, drinking chocolate blends, and any flavored cocoa product, no matter what it claims on the front. Even the ones labeled reduced sugar or diet will quietly contain added sweeteners, modified starches, or oils that destroy the entire metabolic profile you just learned about. Before I close this out, I want to address something that almost never gets discussed in a clinical conversation about food and diabetes, and I think it might be the most important thing I say today. Have you ever forbidden yourself a food completely, only to find yourself eating twice as much of it on a Saturday night, and then spending the next week silently punishing yourself for it? If you nodded just now, please understand, you are not weak. You are human. And your body is responding exactly the way the research predicts. Studies in nutritional psychology have shown something that surprised me when I first read it. People who feel guilty after eating tend to eat more in the hours that follow, not less. The guilt triggers a cycle of restriction, craving, and rebound, and that cycle produces worse blood sugar control over time than a calm, planned, portion-controlled inclusion of the food you actually want. Picture two patients in my clinic eating the exact same 2 squares of 85% dark chocolate after dinner. One of them knows the glycemic index is 22. She understands the flavonoids are quietly improving her insulin sensitivity. She enjoys the chocolate, finishes it, and moves on with her evening. The other believes she is destroying her health with every bite. Her cortisol rises. Her guilt rises. And by 10 o'clock, she has eaten 3 more squares she never planned to touch. Same chocolate, same body. Completely different outcomes. The knowledge changed the experience, and the experience changed the behavior. This is what sustainable diabetes management actually looks like in real life, over years and decades. Not perfect restriction, not iron willpower, plan the inclusion, control the portion, choose the right type. Those 3 things, repeated quietly, beat a lifetime of guilt every single time. So let me bring all of this back to where we started. Chocolate is not forbidden to you because you have diabetes or pre-diabetes. The wrong chocolate is. And the difference between the two is sitting on the back of every package, waiting 30 seconds for you to read it. You now know the 5 forms that the science actually supports. 70% dark chocolate, your easiest doorway in, with a glycemic index of just 22. 85%. Where the clinical evidence shifts to reducing the inflammatory markers that keep your diabetes burning. 100% and cacao nibs, the zero sugar tier, best used as an ingredient woven into yogurt or oatmeal. Sugar-free chocolate sweetened with erythritol or stevia, never maltitol. And finally, pure, unsweetened cacao powder, the cheapest option and the one with the strongest A1C evidence of all. Here is what I want you to do, starting tonight. Open your pantry, pull out every chocolate product you currently own, flip each one over, and read the very first word in the ingredient list. If that word is sugar, set it aside. If the word is cacao mass or cocoa mass, you can keep it. This week, pick up a container of pure, unsweetened cacao powder. Make sure that ingredient list has exactly 1 item. Start with 1 tablespoon in your morning coffee or oatmeal, and check your blood sugar 2 hours after breakfast for the first few days. Your body's response is the only response that truly matters. And at your next visit, ask your doctor a simple, kind question. Given my current A1C, could pure cacao have a place in my nutrition plan? That is a conversation worth having. Now I want to hear from you. Of these 5 types, which one surprised you the most? And which one are you going to try first this week? Tell me in the comments. I read every single one, and your answers shape what I cover next. And if you know someone who has been living under the weight of chocolate guilt for years, send them this video. They deserve to know the truth, and one quiet change in their kitchen could move the needle on their next A1C. I'm Dr. Claire Whitmore. 20 years of sitting with patients across the same desk has taught me one thing more than any other. The right knowledge brings relief. The wrong knowledge breeds fear. I want you to walk away from this video feeling lighter, not guiltier. Everything I shared today is for your education, grounded in real clinical evidence, but it does not replace the conversation you have with a doctor who knows your history and your numbers. And please, never adjust or stop your diabetes medication, whether it is metformin, insulin, or anything else, based on something you watched online, including this video. Any change to your prescriptions must go through the physician treating you. I hope this week brings you steadier blood sugar and a gentler relationship with the food on your plate. If today helped, subscribe so I can keep showing up for you each week with information you can actually trust. Take care of yourself. I will see you in the next one.